Hi, I'm Dr. Coffman of Optimized Chiropractic, and this is episode 4 of What's the Research Say? Today we're going to be diving into different aspects of the neurology of the upper cervical spine. This all can't be covered in one video, so this is going to be part 1. When the cervical spine is in improper alignment, it can affect not only the neck, but the entire body. First, let's start with normal. When looking at the head and the neck, the head should have less than 1 degree of tilt to either side, and the neck should be directly under the head, not translated to one side or the other. The head also should be less than 30 millimeters forward. When the head extends forward greater than 30 millimeters, it's part of a phenomenon called anterior head syndrome, which we'll go over in a later episode. When the spine is in proper structural alignment, the body is communicating properly with other parts of the body, and proper signals are going to the right areas. But what happens when there isn't proper structural alignment? Well, due to the complexity of the cervical spine, many different issues can occur due to that structural misalignment. Before we go forward, let's dive into this complexity. We're going to focus on the top 3 vertebrae and how they are attached to the skull and why that specifically matters. The top 2 vertebrae, C1 and C2, are made to carry the head and help with its movements. Because of this, C1 and C2 have to sacrifice stability for mobility. Obviously, we want our head to be able to turn from side to side, and that is where the mobility aspect comes in, and why we lose the stability that other parts of the spine have. So what are these complex neurological components that I keep mentioning? Well, the top of the cervical spine to the skull, C3 to the occiput, house cranial nerves 4 through 11. These nerves control everything from hearing and balance to regulation of your body's digestion. So there's a lot going on in a small amount of area when it comes to the upper cervical spine. Because of the importance of the spinal cord, you have a protective layer that surrounds the spinal cord, and it's called the dura mater. We've gone over this in previous episodes, and it's a protective layer. This dura mater has attachments to the bones of the neck, the SOT muscles, and the SOT muscles let the body know where the head is in relationship to itself. The dura mater attaches to the spinal cord by denticulate ligaments, 21 pairs, and where these guys attach is extremely important. They attach along the lateral side of the spinal cord, as you can see here, and when there isn't proper alignment and the bones are out of position, the dura is stretched, which then causes the denticulate ligaments to tighten and pull on the outside of the lateral area of the cord, specifically near the spinocerebellar tract, but also near the spinothalamic tract and the lateral corticospinal tract. Why does all this matter? Well, the spinocerebellar tract is closest to where the denticulate ligaments can cause strain, and they receive the brunt of the damage. This is important to remember because these tracts carry information from the legs, the pelvis, and the low back. So what are these tracts? Well, think of each of these tracts like a highway carrying buses filled with information. The spinocerebellar tract is the highway carrying buses of information to and from the brain about the tone of the muscles and joint position sense. The lateral part of the tract specifically sends information from the lower body, the legs, and the low back. So how is all this working? Well, when we look at my wrist, when it's flexed, it's sending information to the brain on that highway saying this is flexed, this needs to be relaxed. And when we go like this, vice versa, those signals are being sent instantly, letting us know that this joint is going backwards as opposed to forward. You can feel it, but it's on this highway where that information is actually carried. We know what these tracts carry, but why does that matter? Well, due to the connections of the spinal cord to the dura and the denticulate ligaments, when the structure is off, it can cause direct stress on the spinal cord, affecting different paths. How does it do this? Well, when the bones have that attachments to the dura, like C1 and the occiput, when there's head tilt, one of the 8 components of a neurostructural misalignment, it stretches that dura. Because of the connection of the dura to the spinal cord through those denticulate ligaments, these ligaments also stretch, which results in the spinal cord being put in tension. Remember when we talked about the tracks as a bus carrying information? Well, imagine if that bus is driving down a 4-lane highway at full speed with other buses. other tracks. But there was a wreck ahead, and now all the cars have to merge and switch lanes, slowing down the bus carrying that information. Due to this tension, you can also have other buses getting on the highway from on-ramps that weren't supposed to be there. When looking at the lateral spinocerebellar tract, the one closest to the dentate ligaments, when you have a structural misalignment, you have direct irritation on the tracks. So the track sends incorrect information to the brain. Think of it like a bus jumping on the highway off of an off-ramp, from an on-ramp that's supposed to be closed. You have information being brought somewhere where it isn't supposed to go. Think how upset you'd be if you boarded a plane to Hawaii for your honeymoon and instead ended up in Antarctica. That's similar to what happens here, but when it happens to us, it's information saying that there's a problem in the low back, in the legs, in the pelvis, when there actually isn't a problem. This leads to the brain to changing the information being sent to the legs, and because this information it's getting from the spinal cord is wrong, it causes a problem. And this can result in muscular imbalance in the legs and the low back, and eventually pain and breakdown in these areas. So that's only one aspect of what can happen when the head and neck aren't in proper structural alignment. It's one piece of this complicated pie. That's all we have for today. So check in next week for part 2, where we're again going to be diving into the neurology of the cervical spine and how your alignment could be affecting your life. If you have any questions, please feel free to email me at drcoffman@optimizecolumbus.com. Thank you and have a great day.